excited to be here today and talk. A little nervous too.
Yay. Yeah, we're excited to have you. Just tell everybody your name. I know who you are, but tell everybody your name, where you're from, and then we'll go
Okay.
from there.
My name is Gloria Lalazis, and we're from a suburb outside of Chicago called Mokina, Illinois. I have two children. Yanni is 3.5. He's my oldest boy. And then I have Georgia, who's my little BWS baby, and she turned 2 this past April.
She's awesome. She's so
Thank you.
freaking cute.
Her piggies tell
You're
all the
welcome.
stories.
Yeah.
So I just start from the beginning, Teresa.
Yeah, start, I guess from whatever, like if you had abnormal stuff in your pregnancy or wherever it kind of started for you, with BWS, because it kind of starts
I
different for
definitely feel
everyone.
like there's
So,
a different experience with every one of us and how some of us find out while we're pregnant. Bill and I did not know that
mhm.
we were going to have a baby born with BWS. I had, interestingly, my son, we had some challenges getting pregnant the first time. And I know a lot of BWS babies are
Okay.
born via IVF. So our son was actually conceived
Hmm.
via IVF. Georgia was a natural pregnancy. However, interestingly, it did
Interesting.
occur 7 months after I had given birth to him. I got pregnant again. So even though it hasn't been
Mm,
proven yet, I think there might be some correlation with some of maybe the medication that could have changed things
mm.
for me in utero and could have contributed to the development of the BWS. Because
Interesting.
I know
I mean,
Dr.
definitely.
Kalish, sorry, my dog dropped my water bottle. Um, Dr. Kalish
That's
had shared
okay.
with me that it was 1 in 1,200 pregnancies that a child can be born affected with BWS via IVF. So that to me, it was more of
Hmm.
a significant number than just the natural occurrence itself.
Right. Yeah,
So
definitely.
I pretty much had a normal pregnancy up until 34 weeks gestation. Everyone in the family was kind of saying, "Oh, you look like you're measuring very large for your age. You look like you could give birth any day now." Um, so I went in for my routine check and I mentioned it to the doctor, and they're like, "Yeah, you do look very large." So they did the measurement, and I was measuring at 38 weeks and not 34. So, like, we're going to send you for an
Wow.
ultrasound. You are having excess fluid on your abdomen, so we want to make sure that everything is okay with the baby. So they sent me for an ultrasound, which I
Hmm.
went to by myself, which I normally did because someone would be with my son. My husband was working. And they're like, you have a condition called polyhydramniosis, which is excess fluid in your uterus around the baby.
Hmm.
And they're like, her tongue looks like it's enlarged. Her head looks like it's enlarged. Her organs are all large.
Oh
We don't know if
God.
she has Downs. We don't know all this. I mean, they even brought up the possibility of terminating the pregnancy. I think
Oh my
that
God,
far
that far
along.
along?
And,
They mentioned that
I
to
don't
you?
even think that's legal, but I think the
Wow.
doctor was so taken back by what she saw on the ultrasound. I mean, her approach was horrific. Um, and I was in
God.
a state of panic. Um, my dad
Yeah.
actually came to get me because I couldn't even drive. I didn't know what was happening with my child. I
Oh.
didn't know what was going on. So what they said was like, let's go back to another hospital tomorrow. We'll do another ultrasound and we'll verify everything the hospital where I was going to give birth at. What are you doing? Say hi.
Hmm. Hi, buddy.
um, so I went in the next day and I actually had a little bit more reassurance. Her tongue was definitely enlarged. However, the organs weren't unusually large. They didn't see any difference in the shape of her head. So, what the one radiologist was reporting to
Hmm.
me, which was greatly traumatic, was not actually what I was hearing 24 hours later. There was still a problem that we were unsure
Right.
and unclear about, but they were a little bit more prepared and
Hmm.
we felt better about the situation. So what they had told me was that I would be probably go to term, but what they were going to do was give me a steroid injection to help protect the baby's lungs in case I did go into labor early. I think the stress from
Right.
hearing all of that over the course of 24 hours um, caused my water to break because later
Yeah.
that evening, my water broke.
Oh my
And I
God.
remember getting out of bed to go to the bathroom and then getting back into bed and it just popped. And my 38-week belly, I looked like a 5-month pregnant woman at that time.
Oh
So
my
I was
God.
scared. We made it to the hospital. They're like, everything's going to go okay. We're going to deliver the baby. And then her heart rate was decelerating. So they're like, we're going to bring you in for an emergency C-section.
Oh.
We went
Oh
in.
my gosh.
Within minutes, she was out. I heard her screaming. They called out her APGARs, the highest being 9, which was like reassuring to me. And I remember the first thing saying to my husband
Yeah.
was, does she look okay? We had heard all these things about all these
Mhm.
possibilities that she could have. And he was like, she looks fine. She just has a big tongue, Gloria. And I was like, okay, okay. Um, Following that, we were able
Yeah.
to see her. They hadn't thrown out the diagnosis of BWS yet. They kind of just let things sit for the night. And then the next day, they're like, we're suspicious that she may have this. We have to get a geneticist in to do her blood. They gave me the time period of like it being almost 8 weeks to treat her. Meanwhile, I'm like,
Mm.
what does that mean for her? And they're like, well, we don't know a lot about
Yeah.
BWS. So that became extremely scary because
Yeah.
we went from not knowing what our daughter had to possibly knowing what she had and no one knowing what to do with it. So now we were faced with all of
Right.
these challenges in addition to having a 17-month-old at home. What were we going to do?
Right.
So within 4 days of Georgia being born, because she was born premature, she was on oxygen. She was in the little incubators. We weren't really able to hold her,
Mhm.
and she wasn't passing bowels. They were feeding her via an NG tube at that time, and they're like, we think she's got an obstruction.
Okay.
From
Oh.
looking back now, and after having discussed things with Dr. Kalish, it was a form of an omphalocele. She ended up having like an
Oh.
ileoband that was causing a blockage in her intestine.
Wow.
And basically, she didn't develop the omphalocele, but something happened inside the intestine which caused the blockage. So she had a portion of her
Wow.
colon removed at 4 days old, and they also took her appendix.
Oh.
Uh, yes,
Jeez.
Georgia has lost a lot of organs, but she perseveres through
Oh.
everything. That's why I have a smile on my face now. So I'm like, oh my
Yeah.
goodness, my baby, 4 days old. She's only 34 weeks old. She's going to have a major surgery. How is this going to be? She
Yeah.
had the surgery. She ended up having like a little ostomy bag for a few days. They took it off
Mhm.
and she was moving her bowels back again to normal. The one problem that she was facing, we still hadn't seen a geneticist. Now, this is going on a week. She's still on oxygen. She's still being
Mhm.
fed NG tube. They were telling me I couldn't nurse her. I couldn't bottle feed her because she was on a high flow of oxygen because of her early age. Meanwhile, I was
Mhm.
like, when are we seeing this geneticist? And and they're like, well, she'll be
Yeah.
coming. Meanwhile, we sent the labs off to Mayo Clinic, and we'll know by the time you probably go home. So we had hopes that we were probably going to be going home
Mhm.
soon, and there wasn't going to be much of an issue. She seemed to, once we got her
Right.
down on a regular flow of oxygen, they're like, she'll be able to go home. Now Georgia started developing low blood sugars. So they're like, well,
Oh.
this can happen in premature babies. So it was a lot of unknowns. She started on like a dextrose
Right.
infusion and they were trying to manage her sugars, which just kept going up and up and up on dosage just to try to maintain a sugar above a normal level of 70. And she was being
Right.
NG fed as well. Um,
Okay.
One of the neonatologists at the institute that we were at had reached out to an outside endocrinologist, and she was like, well, we need to put her on this medication called diazoxide. Meanwhile, we were kind of not really researching the BWS portion because so much was going on with Georgia in the hospital that we were just trying to figure out what the
Right.
answers were and what was going to happen with her. And when you Googled it, there wasn't much
Yeah.
that did come up, unfortunately. So it was like the kids were
Right.
born large, the kids have large tongues, kind of those standard clinical features, which we now have learned aren't usually the typical signs. There's a huge spectrum.
Right.
So
Yeah.
it wasn't until about 2 weeks into her being born that I actually started to really look at things. And I'm like, okay, like her tongue is large, like what's going, and they're like, she's going to grow into her tongue. Like it's not going to be an issue, all of this stuff. She was declining down on her oxygen, like things were progressing forward, but the sugars were still an issue.
Oh.
Meanwhile, they started this medication, didn't seem to be making much of a difference. And we had reached out to another institution seeking a tongue reduction. Unfortunately, because of Georgia's health at the time, we were turned down. They wanted her to be older and stronger because they felt they would have better success with the surgery at that time. Meanwhile, Georgia's health continued to decline, and we were told, her belly was growing larger, and we were told, oh, that's BWS, their organs get large. Her sugars still weren't controlled, and her oxygen saturations were getting worse. And we were told, oh, it's because she's got the big belly and the large tongue. That's why she can't breathe. We're going to give her a trach.
Oh, no.
I haven't told everybody. So I was a nurse. I've been at home with her since all these challenges have developed. So to me, I was like, a trach is a lot of care. It could lead to a lot of illnesses.
Yeah.
Is this the only option that my daughter has? Like there's, I heard about these tongue reductions. There's this possibility, but they want her to be stronger. How can I get her there? And I also kept thinking, when she was so new, she was breathing better than she was 2-3 weeks into her life. Why did it get worse? If her tongue didn't get any bigger, if anything, she was getting larger. And the tongue seemed to be the same that it was when she was born. And just like they had mentioned, like she appeared to be growing into the tongue. So why was her oxygen getting worse? Why was this medication not helping her sugars? And I asked then to be transferred. We were in a community hospital in the NICU. I asked to be transferred to a major medical center. We had a family meeting. They had told us that these challenges that Georgia was facing, they knew how to treat each and every one of them, but not in the whole context of things. But they were specialists, and anything that we got down at the university would be the same thing that we would get here because they don't know how to treat BWS. So we were left being scared, not knowing where we were going to go. And my sister-in-law was like, "Why have you found any blogs or any social media stuff on BWS?" And I had, and I went on their page and I just said, what the heck, let me post, has anybody had an experience with a child with a large tongue getting a trach? And a fellow mom had told me about CHOP. Now, it was one of the things I saw in my Google searches. And I saw that they were an institution, but with hearing this from the experts where we were at and being in a major city, I thought no one knows how to treat BWS. Why would we leave and go all the way to the East Coast for the same care that we're going to get here?
Right.
And so
Exactly.
this mom and I corresponded back and forth, and she shared her son's story with me and told me they do tongue reductions. It doesn't matter what age. You need to contact Dr. Kalish. And so I, in my morning routine, getting ready to go to the NICU, I said, well, what the heck do I have to lose? They want to put a trach in my daughter. We don't know what's going on with her. She's now intubated. Her sugars are all over the place. Her health just continues to decline. And I was in fear that she was going to die if I didn't do the right thing for her. So I sent this email to the bws@chop.com. And within an hour's time, I got a phone call, and the voice on the other line says, "Hi, this is Dr. Jen Kalish." And I was like, like taken back, as a healthcare professional, and I know you are yourself.
Right.
We aren't used to doctors. They usually relay the message through someone else. I was expecting a call from a nurse, maybe a secretary, maybe even a nurse practitioner, not the physician herself. So she was familiar with the mom I spoke to. She's like, I know them very well, which was kind of reassuring to me because this child was already, 4 years out. And she still had them near and dear to her heart. And the story was just like a mom had shared. And I was like, wow, like she really likes her patients. And she shared all these things, like, and offered lots of promising. She's like, we have an HI clinic. We deal with everything that Georgia was facing. They had an approach for, and it was not just a single approach. It was a multidisciplinary approach. They had a plan.
Right.
So they're like, we'll fly her out there. We'll go through insurance. So my husband and I go to the hospital, and we're like, yeah, we talked to this doctor. And they're like, yeah, right. I mean, literally, they were kind of like shocked. And they're like, I'm like, she gave me her cell phone number. I can call her. In a room full of medical professionals, including 3 physicians, the manager of the NICU there, Dr. Kalish, explained the things that they're able to do for BWS kids. And I watched a room full of professionals' mouths drop in awe. I mean, they were like, they do tongue reductions on, like, they're like, what's the youngest child that, you do them on? She's like, there is no young age. If the child is in need of it, we do that. How do you treat HI? She's like, you need to put them on a diuretic. And she doesn't, her specialty is genetics, but yet she still knows how to care for these children across the board. Yes, you've got to see those experts, but they have them in place. And she knows who to get you to and the right referrals. Within a week's time, we were transferred out there. Georgia was still intubated. Their flight team flew her out there. Within 24 hours, they found a tumor on her liver. And we were told that her belly was just getting big because of the BWS and the organ megaly. Like, that's normal for BWS. That's why her organs are large.
So they never even scanned
her? The unfortunate thing is they did scan her and did not see a 5-centimeter tumor.
And they missed it.
They missed it.
They missed it. Oh my God.
So I was devastated. My background was oncology, and this was one of those things you read about BWS, but you never thought you would have to face. And I thought, my God, she's 8 weeks old. How could she have cancer? It's got to be hemangioma. It's got to be something else. Maybe it's a benign growth. And they're like, the way it looks on the ultrasound, we don't feel that it is. And because the liver is such a vascular organ, the best course of action is to do a surgery. So our plan, thinking we're coming out there for a tongue reduction, we're going to figure out how to manage her HI, went into now a cancer diagnosis, and we are now going to live in Philadelphia instead of Chicago. And we made arrangements for my son to come back, and we were at the Ronald McDonald House for the first month. We were in Philadelphia, and then unfortunately they were under construction, and with a 17-month-old and all of we decided to rent because we weren't sure how long we were going to be there, and we just wanted to be a family. We wanted to have a dinner together in the evenings together and switch shifts. So I mean, I have to say, when we met all of these challenges when we came to CHOP, although all of it was extremely scary, knowing that they had a plan of action and what the next course of treatment was going to be was a huge sense of relief. We finally were getting the answers that we were seeking. Meanwhile, Dr. Kalish had mentioned retesting her blood. She's like, I know they did this, but we have our own lab here, and we look for specific things, and we want her blood tested here so that we can make sure there's not a difference. Because now they were able to obtain the reports from Mayo. Over those next couple of weeks, while Georgia underwent the tongue reduction, the liver reduction, and then finding out we needed chemotherapy, we did get the results of her genetic test back. And interestingly, it did show that she had the UPD type, which we know has a intermediate risk of cancer, but it was different than her original Mayo Clinic labs. They didn't have the UPD type on there. Yes.
Oh my gosh, this is crazy.
It is, and not to discredit their institution by any means. I mean, they made the diagnosis, they knew she had it, but they weren't testing for the subtypes like Dr. Kalish's lab is. And it's because she's studying this and she knows the differences. And for us as BWS parents, we need to know, what our child is facing. Knowledge is power, even though it can be scary. Because there's 3 subtypes that we know now, and what could be in 5 years? They might find 2 more,
Exactly.
So we started to get even more relief. We knew we were facing lots of challenges, but things were coming together, and they had a plan of what we were going to need to do. We spent a total of 5 months in the NICU.
Oh my goodness.
Georgia persevered through everything. She got all the therapies, all the physical therapy, occupational therapy, speech. She went through 2 rounds of chemotherapy. She weaned herself off a pain pump. We had at one time, I thought there was probably like 6 or 7 IV pumps and lines going. She had a PICC line. She developed a blood clot. And then at the very end, when chemo was done, surgery was finished, she was healed, she still wasn't eating. And she was still being fed by the G-tube. So now the challenge was, if we want to get her home, do we put in a permanent feeding tube?
Right.
And I'll never forget, another mom across the NICU said, do you want to see my son's G-tube? He has one, and maybe it'll make you feel better about getting one. And I really appreciated her doing that for me. And it made our decision a lot easier because I saw it wasn't that big of a deal. It was just another apparatus. And Georgia had faced so many challenges. This was just one more step getting us closer to home. And it didn't mean I was going to stop trying to feed her or get her to nurse or drink from a bottle. Whatever I needed to do, that wasn't going to change. This was just another thing that we had to endure to get her to where she needed to be. So September 9th, 2017, we finally left the hospital, and she was born April 22nd, 2017. So it was a very rough first year. And I do have to say, a lot of the moms that I met whose child was born at CHOP with BWS, their stay was not as long because they knew right away the care that these children needed. So that intervention was in place quickly. And I felt like here we were in this major city, and we missed almost like 8 weeks of an opportunity to get her the right care that she needed. But, we got home. I had early intervention come in. I was expecting, the whole shebang, which Georgia got. She got occupational therapy, she got nutrition, she got speech, she got physical, and we had G-tube feeds. We had all these challenges that we needed to do. So Georgia kind of felt a little bit more like my patient than my daughter. But I think keeping myself busy with all of that didn't really allow me to focus on what had actually occurred. I was still, I hadn't even processed it. Because
didn't even breathe.
And then meanwhile, still, I was like facing challenges, like being a mom with my first son. And he wasn't speaking when we came home, and I had a huge sense of guilt that it was because of me and the things that Georgia was facing. But I learned that necessarily wasn't the case, So we went on to do our every 3-month scans, our AFPs. And I know there's like a big, huge controversy about the AFPs. Like, a lot of people are like, when does it normalize? We were never normal that first year. It trended down, but it was still above normal. So I was always like, but I still had that notion in the back of my head, like, we had cancer, it's early, it's not going to happen again. Like, what are the odds? And then literally a year to the date of her first diagnosis, we find out she has another tumor. Now, CHOP's plan was to, part of their regimen for the HI was to bring us out there for an annual scan. So we had plans in June of 2018 to go to CHOP for a scan, or for her fast, to see if she still needed to be on the medication. And meanwhile, the team, we were at a major medical center in Chicago, and they're like, oh, it's probably not cancer. These kids have an overgrowth. The AFP is trending down, even though it's not normal.
Oh my God.
They're like, I think we just watch and wait, which would be 3 months later. I immediately text Dr. Kalish, and she's like, oh, no, not with her type. She's like, you're coming out here. I'll make all the arrangements for everything. We'll get it done, and maybe we can do a biopsy of it. So, because Chicago didn't even want a biopsy it. They're like, and it's in a highly vascular area. And, not that they're not, but I think the way that Georgia's second tumor presented wasn't the classical appearance. Normally, they,
Right.
because there might be lingering cells or something, this was a completely different area of her liver. So they were like, well, it's probably just an overgrowth. She has an overgrowth syndrome.
Wow.
But again, because CHOP sees the majority of these children, they know not to take those unwarranted risks. Like if they see something on their kidney or their liver, they're going to be aggressive about it
Right.
because they want the best outcome for your child. I mean, if we would have waited 3 months, Georgia, the cancer
Exactly.
could have spread to her lungs. She could have had metastatic disease, and that would have made her have a longer course of chemotherapy. So we went to Philadelphia.
Oh my
We had
God,
the
it's
we had
so
the fast.
crazy.
She did not pass her first year, so we're like, okay, she still needs to be on the medication. They did the biopsy. I'm sorry, what'd you say, Teresa?
I said it's just so crazy. Just the fact that 2 times, like she could have been
Mm-hmm.
missed. You know what I mean? Like it just gives me the chills.
I mean,
Oh,
there's no standardization of care, and there really needs to be worldwide, because there are children. I mean, I look
yeah.
at
Yeah.
where Georgia would have been if we didn't know the things that we did, reach out to the people that we did, and just want answers to the unknowns. And
Right.
I can understand not being able to do that
Yeah, I
because
mean,
of what your child
she'd
is
be
facing.
trached. She'd be
She betrayed who they probably would have
right.
never found her cancer
Like
until it
it's
was
just
further gone.
she would be trached.
She could be dead. I mean, I,
Yeah.
it's, I mean, that is the
Yeah.
reality. Sometimes I think back, like, if they never caught her cancer and they put the trach in and they were focusing on all this other stuff, this obviously it grew rather quickly. So what would have been when they found it? Would
Mm-hmm.
they have been able to treat it? How sick would she have been? And that
Right.
would have maybe perhaps delayed her even further than what she was.
Yeah. I think that's what people don't realize is like, because people that I talk to, I had a woman reach out to me recently and she is suspecting that her child has this. And she's like, well, I might pursue it, I might not, just because, they lead normal lives. And if once they, find the cancer, then they deal with it. And I'm like, yeah, but the thing is, it grows a lot quicker in these kids than it does in a normal child. So,
Mm-hmm.
so I hope, I gave her all the information. It's whatever she's going to do with it. But I think people don't really realize that. Like, yes, the protocol's in place to catch it early, but it does grow so fast in them that it's like, it's a
And I think
big
people
deal.
are just, I mean, I get it. I'm like, I don't sleep the week of Georgia's scans. I'm with my nails on,
Yeah.
like biting my hair, like, but knowing that they found it
Yeah.
and treating it early on makes a huge difference. And if you don't, then the
Yeah.
alternative is a lot worse, because it goes to other areas of the body and they might not survive. And these little guys, I
Right.
mean, even though they can deal with chemo pretty well, I mean, working in oncology, I was like, I know these drugs, I know what she's getting. And I was like, okay, I can do this. I
Mm-hmm.
know this. And her reaction was completely different than what an adult would get. I mean, I remember
Really?
going in and she was fluid overloaded from one of the chemotherapies, because they have to give so much hydration so that it
Oh.
doesn't damage their kidneys. Teresa, she was like breathing like how she was when she was intubated. And I was so scared that she was going to get intubated again and like
Oh.
things were going to get. And they're like, no, 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 like this is fluid overload from the chemo. We know this. We give them some diuretics. It helps get it off their body, and they just need a day or two to recuperate. So just knowing that they saw this and
Oh.
they knew how to treat it and it wasn't abnormal for them
Right.
made me feel better, because when I saw her, I was like, this is not good. We're going backwards. We're not going forwards. What does this mean?
Yeah.
Um, I mean, so now the second time around, we were like, we got the biopsy, we passed the fast, and our plan was that, okay, they know this is we're gonna go back home to Chicago. CHOP will give us a plan, and we'll get treatment here.
Mm-hmm.
So we're on our way back
Mm-hmm.
home. We get the biopsy results, and now they're like, it's a hepatoblastoma, but it's different than the first one. And CHOP
Oh
was
my
like, we
God.
need to reach out to some of the other experts who are familiar with hepatoblastomas because we've never seen a BWS kid develop it that quickly within a year. And we want to make sure
Oh my God.
that we're doing the right thing for treatment wise. So that I appreciated right then and there because they again knew what the
Yeah.
right thing was to do. Instead of just saying, hey, let's do this regimen, they're going to reach out across the country and they're going to see if anyone else has seen this before and they're going to give her the treatment that she needs. So I'm like, okay, great.
Yeah.
We've got a plan. I feel good. We got to get our treatment in Chicago because we can't be out of the city again and living out of town and doing all this stuff. Like we just can't afford to do that. So we come back to Chicago
Right.
and they're like, okay, we're putting in a portacath and she's going to start this treatment. And so I had a whole list of questions. And the
Right.
oncologist here said to me, well, what are you reading off of my paper? Why are you asking me these questions? I said, one, because I'm a mom. I said, and
Oh,
two, because this is my daughter who has a rare diagnosis that she can continue to get cancer for. So I'm looking at her quality of life. Like, how will she be if we can? What if her
right.
cancer comes back again next year? Are we going to give her the same regimen? Like, I'm asking these questions because I care about my child. So I again reached out to
Yeah.
Dr. Kalish. She's like, let me share with you who we've reached out to and what some of their plans were. And she's like, I want you to speak to the oncologist who originally treated Georgia at CHOP as well. So again, an oncologist, somebody who takes time out of their busy day, they usually don't do that. She called me on her way home, walking home
Right.
from CHOP that night. And she said,
Oh.
go to Cincinnati. She's like, it's right in your backyard. And I feel that this Dr. Geller might have a lot of insight into Georgia's tumor because we haven't seen this. A lot of the experts at all the institutions
Wow.
that we reached out to haven't seen this. And we want to make sure Georgia gets the best treatment that she deserves. So I
Wow.
appreciated their honesty. And, Cincinnati is one of the hospitals that is working with Dr. Kalish under Alex's grant, which is amazing because
Yeah.
we need
It's
more
awesome.
unity. We need everybody coming together for this. So flash forward, like
Yeah.
knowing that, finding that out this year, I'm like, that's great. Like that's where we were at for her treatment because it was only 4 hours away versus like 15 hours away.
Right. Right.
So this Dr. Geller knew Dr. Kalish. Dr. Kalish actually went out there during the time we were there, met with their geneticist. So they were kind of working on this stuff in the background of things. And he was like, oh, she's got BWS. I have never seen a tumor come back in a year, but I've seen it come back in 2. So this is how we're going to treat it. And he ended up giving her the same regimen she got the first time around. And his reasoning was this was now, even though it was the same type of cancer, it was a different genetic makeup of it. So the chemo was going to work the same way it did the first time.
Wow.
And that's what Chicago.
Okay.
Hang on, buddy. I'm sorry. It's okay. Our dog
Aw.
stepped on his hand. So that was what the challenge was that Chicago didn't understand. They felt like this was the same treatment, so they had to give her different drugs that would be more toxic to her body.
Gotcha.
Where when they actually looked at the genetics of the tumor, they're like, this can be treated the same way we did before. It will have the same reaction.
Right.
And 9 months to the day, she's cancer free, thank God. During
That's
her
amazing.
chemotherapy, Teresa, they never gave up she was continued to be G-tube fed. She started eating and drinking. I mean, it was like,
Good for her.
I don't know if it was God doing a divine intervention to get me to feel better, or it was all the work that we had put in, the speech therapist, myself, my husband, but boom, behold, she started eating. I was like, so they say you lose your appetite during chemo. I didn't really get that when she was so young, because she was NG fed, and now she went from being G-tube fed to eating during chemo. Like, how is this crazy? Like, this is not happening.
That's awesome.
Yeah, so
you needed that little ray of sunshine.
I did. And she did not end up getting a port because I was nervous about her having another surgery, opening her body, putting something in. She ended up with a PICC line that I was able to care for myself at home. And
Good.
she persevered through chemotherapy. this past year at CHOP, passed her fast, so she's now cured from her HI. And just like
Yay!
Dr. Kalish said to me, after 2 years, it's going to get better. And she was right. It was really
Yeah.
hard to see, but she was right. I mean, she
It's
knows
so
these kids.
awesome.
She knows how they are, their progression. And I mean, it's a disservice for people to not at least speak to her. And
I
you know,
agree.
I mean, you know this, and whoever's live, you know, I'm trying to start a non-for-profit organization. Whoop, whoop, whoop.
Woo!
Um, and the sole efforts are going to be donated to support Dr. Kalish or any other physician who is studying BWS, the epigenetics of the cancer, so we can have standardization of care. We can not have to travel
Yes.
across the country to get the care that we need. Other physicians are going to follow suit to the things that she's discovered and pretty much made standard of care at CHOP. And I think through awareness and people speaking about it more, I mean, there's power in numbers. It's the only way we're going to be able to do it.
Yep, exactly. I think she really is one of those doctors that it's like her
It
life's
is.
work.
Another mom had shared with me that when the whole, and I'm not going to get into any politics, but when Trump was elected president, they were very concerned about her being able to do research. And she had shared with that mom, don't worry, if I have to take it to my basement with all my children's toys, I will. Which speaks volumes.
She's so awesome.
You know?
Oh my God.
I mean, any doctor
she really
who gives you their number,
go ahead,
who will call you whenever you have a question, and just knows the places to get you to and the people to connect you with. I mean, she's really like, she's more of a friend than, I mean, she's our doctor, but she's more of a friend now than anything. I mean,
she really too, like the one thing I love about her is that she is not afraid to put her, well, she doesn't even have an ego, but she's not afraid to put any of that aside and say, I need to check with someone else, or I need to see what else is happening. And I think that's one of the biggest hurdles with BWS that I've seen that I think needs to be overcome. Like, people need to just really realize this needs to be a collaborative effort, and we need to really figure this out for these kids, because there are kids in all different states getting such different care, not diagnosed. And it's just crazy, because your daughter could have a totally different outcome right now than where she's at.
I feel like almost every child that didn't come through CHOP's doors could face that. You know, I mean, it's heartbreaking to sometimes even read some of these things on the Facebook page that, you know, their doctor doesn't feel that doing the ultrasounds or the AFTs is worth it because, you know, they have a low risk of cancer. I mean, Georgia has an intermediate risk. There's, you know, the IC1 is an even higher risk than the type that Georgia has, but yet Georgia's had cancer twice. So it doesn't necessarily mean that it can't happen to, I mean, the kids with the lowest risk. It's still a possibility. And those tests need to be standard at every institution. And there needs to be more physicians doing what Dr. Kalish does, being humble to what they don't know and reaching out to people who do. So that's the only way that the children will get the care that they need. They won't get trachs. You know, there was a mom that I had connected with from Chicago via Facebook, and her daughter was in the NICU for a year. I couldn't imagine.
Oh God.
And she had a diagnosis of a metastatic hepatoblastoma. She had gotten a trach, and I had thought that could have been Georgia. That could have been Georgia. And I feel very fortunate that we found Dr. Kalish, and I feel fortunate that I got out of my shell and reached out on social media. You know, I had, you know, I feel that can be a challenge for some of us as well, because it's a rare disease and there's not much known about it, and cosmetically it can look different. people might be scared to
Right.
put that on social media for what they might get back.
Mm-hmm.
And,
Yeah.
there's no harm in reaching out. In this day and age, there's a lot more connecting and people who, by doing that, look at you've been able to share Owen's story, share your family story, and connect people to the right places that they need, not only with the institution, but maybe with like tips for feeding your child or like a baby carrier for those of them that have larger babies. Um, those are
Yeah.
things that people wouldn't normally know, and they're just struggling on a daily basis, just trying to figure out how to get their child comfortable, how to carry them around, how to feed them
Right.
appropriately, what kind of bottle to use, what kind of pacifier to use, um, in addition to
Mm-hmm.
all of those medical challenges. So I really hope, and
Exactly.
we're going to be working together once we get the approval. Um,
Yeah.
from speaking to a few foundations here, people who have founded foundations, to make a general difference in like what we're able to donate.
Mm-hmm.
But I know myself, and I know you as well, and like our family, we're up to the challenge. I'm not, I'm not ashamed to
Right.
tell George's story or anybody else's story and tell them about what's going on at CHOP. Um, and I feel
Yep.
like doing these segments are wonderful. Teresa, I'm so extremely proud
Oh,
to have
thanks.
met you, and I feel very fortunate to be a friend of yours.
Oh,
And thank you.
I
And
agree.
I think it's awesome what you're doing because you're bringing a community together, and we didn't have that before. I feel like the Facebook page
Yeah.
is it's a good thing to have, but we also need these live things, these
Mm-hmm.
people telling actually what is going on in their lives. And I feel like when I went to
Right.
CHOP that first year and we went to that first conference, I didn't know what to expect when I walked in to meet these families. And I saw a whole bunch of parents and a whole bunch of kids playing around in a room. And I was like, this will be Georgia. Just like Dr. Kaler said, once they're two, they're good.
Yeah.
So I think, people put things
Mm-hmm.
online and you read all these comments from everybody, but actually like seeing their story and hearing the outcomes, and that who is extremely hard in the beginning, but it did get better if you listen to the right people and you follow the
Yeah.
right guidelines. It gets better, but they wouldn't know that if you didn't have these. You wouldn't know about half the people out there, all the adults. This year attending the
Yeah.
conference, that was a new thing for me. I had always been familiar with the children and learning about all these kids, and it's like, wow, there is a community of adults, and it's growing.
Mm-hmm.
And
Yeah, it's kind of crazy to think
right,
about.
and it's also kind of good to connect with them as well, because I feel like although there's a physician out there
Mhm.
who knows these kids and on their challenges and what they face and how things will end up being for them, actually seeing an adult who's lived through it and maybe not gotten all that care, you see what a great person they've turned into. They're
Definitely.
fully functioning, they're working, they're married, they're having children, yeah, they're attending college. So much variety of
Mm-hmm.
stuff. And it's like, okay, so your
Yes.
kid's going to be okay. Um,
Yeah, it's one thing to like read it online and have it say like most of these kids grow up to live a blah 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 great happy life, but to actually see it when your child has gone through so much, you're like, there is truth to that
I mean,
writing.
all of it,
There, that can be my baby.
it's pretty much like peace of mind. Like because I feel like, and you're still probably
Mm-hmm.
going through this, Teresa, because Owen's he just turned a year. How long ago?
He's
Oh,
19
oh my
months
gosh,
now.
he's almost.
He turned
I was
1
gonna
in
say it was.
February.
So it's probably getting like more sinking in now. Like it's like that first year was super challenging, and now it's
Yes.
like everything is starting to sink
Yes.
in, and you've connected more with people.
Yes.
I know for me, every time I was so nervous to tell my story, and I don't know if it was like the way we were brought up. I
Mm-hmm.
feel like, I was always kind of taught to like not look at somebody who looked different. You don't want them to be thinking you're staring
Mm-hmm.
or anything. And I feel like it's a days, and yes, it's okay to be a little different, but there's nothing wrong with that. you know,
Mm-hmm. Exactly.
and
Yeah.
it,
I'm super excited for everything that's around the corner. I'm like, whew, I can't wait.
I can't wait either. I mean, and
And
now,
I just feel like, go
oh
ahead.
no, go ahead.
We're on a little bit of a delay, I
Yeah, we
think.
are. I know it's funny to see somebody talk.
You can go.
No, I was gonna say like our collaboration with the Italian physicians, extremely exciting, and having
Mm-hmm.
got to Monica and Alex, I mean,
Yeah.
that was huge. I mean, I was like, wow, like I mean, and I,
Mm-hmm.
after meeting her on him, I mean, they're going to make a difference in Europe. They're going to bring it across
Oh my God, yeah.
all those countries there. And I know Monica, she's not going to stop. She's very driven. And I think she's going
Yeah,
to,
she's not playing around.
and I love it because she's also had a lot of insight to help us with
Mm-hmm.
where we are here. I mean, she knows that it's not an easy process and that it takes time, and she gave me a lot of helpful tips when we were out there as well. Um, so I really appreciate that, and also the things that they're doing. Like they're doing things a
Mm-hmm.
little, even though they're following the same guidelines. Not necessarily like more people are coming to them now for like, for instance, like tongue reductions, and kids might not necessarily need them. They're
Mm-hmm.
finding out that not everyone needs a tongue reduction, or not everyone needs this. So
Right.
that's why like us all coming together is extremely exciting, and I think it's giving us moms a huge sense of just relief, I guess I would say, like that
Yeah.
things are starting to change already. It's not where we want it to be, but we know it's
Mm-hmm.
going to be there. And it will probably happen sooner
Yeah.
rather than later because we have some really strong people with big voices who want to make a difference.
Yes, exactly. Exactly. I'm just so thankful that Dr. Kalish put me in contact with you, because it is hard sometimes to connect with people, or to know like if you're connecting with like-minded people, or you just never really know. And as soon as I met you, I was like, oh, this is going to be so great. And then I met Monica at the conference. I'm like, this is going to go somewhere. Like, we are really going to do something about this.
Oh,
And
that
it
warms
just
my
makes me
heart.
so
It
excited
warms
for
my
our
heart.
kids, because
I feel that a lot of the moms, I mean, I don't know if Georgia will want to be a part of this when she gets older, but that's kind of my hope, like, right? And
I know, right?
my husband's always like, well, don't expect her to just want to, like, I'm like, I'm not expecting anything, but it's my hope because, the, even though,
Mm-hmm.
we were able to get her to where she needed to be and she's doing so great, the purpose of education is to make everyone else in the future and for there not to be challenges.
Exactly. Oh, you're frozen. Oh, I lost half of you.
That's okay. I was like,
You
wait,
got
I don't know if
frozen
she
for a
heard me or
second.
okay. No,
I
I said
didn't.
our
It like
children.
cut out a little bit.
I was at first. I was like, I think our children
Go
will be
ahead.
proud of us. At first, I said, I think our children will be proud of us, but I'm
Hopefully.
like, no, they will be. They will be because they're gonna say, wow, like, look at what our moms did. And it's like, flash forward like 20 years, Teresa, we'll be sitting there like everyone's doing the same thing. Everyone, there's not a
Yes.
that I had reached out to were chapters of one that was originally formed somewhere else. So the process was a little quicker for them because
Yeah.
they didn't have to do all the steps. So I'm like, That's what I would love to see 20 years from now is various chapters. And Monica and I have discussed this, just like
Mm-hmm.
branches of the foundation everywhere for everyone to do this wherever they want it to be, because there'll be physicians in every state, or at least every state we can start off with. Maybe not every, and hopefully every major city.
Oh my gosh, it would be so awesome. I know there's people from really all over the world, all different countries that have reached out to me that are like, "Oh my God, if you can get something like what you guys have over there in place over here, please, 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 please." And I'm like, that is a big goal, but it's a goal that I would love. Like, it's a goal that would be so amazing. Someone from Turkey messages me all the time on Instagram. He has a son with
Wow.
it, and he's like, I would just love, yeah, he's like, I would just love to connect with you guys and actually meet your physicians and just have the standard of care over here. Someone in the Philippines has messaged me. I mean, it really is, it's across the board, across the world. People are searching for help.
And
So
that's
I'm like, it is a big task, but I'm going to try and
and that's
figure it out.
amazing that from countries across the world, like 10 hours difference in time, they know about your page and they know about these segments. I mean, that's awesome.
Yeah.
I mean, that is
I,
awesome. I mean, pat yourself on the back, because if I was, I'm giving you a virtual pat.
thank you.
I mean, because
Oh,
that's awesome.
thank
I mean,
you.
that's,
Yeah, I'm trying to connect with as many people as I can. So, yeah, and I'm just like, now I'm at the point where I was hesitant at first, but if I do come across people on Instagram that their child makes me like stop and
hmm
scroll back and like look at them again, I'll wait a little bit and then like look through their feed, and then there has been a couple times where I'm like, I think I need to say something to this mom. I don't think they like their baby looks like this is what they could have. So it's usually well received, but and I don't know if the moms have ever, taken that to their pediatrician. I don't know, because I don't necessarily think people take it seriously yet. But yeah, I mean, I'm on a mission.
you are, just like your shirt states. It's funny that you mentioned that. I mean,
Yeah.
my sister-in-law, she's a developmental therapist. And over the course of this past, I mean, George's life, she, knowing about BWS and the things that we've learned and the things that she's seen, and just being honest with this process, she evaluates kids that come in, through early childhood. And she's like, there have been kids that she could say, I think they had BWS. And
Mm-hmm.
being the developmental teacher, she's not sure of how to take that approach. You ask them if they've ever had genetics, or if the doctors ever made any, or if they've, if they had any challenges with like low blood sugars or things like that. Um, so she finds alternative routes, but people are starting to think about it. So I think you bringing it up to people, not necessarily a bad thing. And if people take it the wrong way, yes, honey. Oh, looks like somebody broke a pumpkin.
Uh, wow, he did that quietly.
He banged them together.
Oh my gosh, I didn't even
I
hear
know.
it.
Just pick up that piece, sweetheart. This is what happens when moms end up doing blogs. It's okay. It could have been worse. There could have been money flushed down the
Yeah,
toilet.
this is exactly what happens. That's why. That's true. Well, thank you so much for coming on here, and I'm so glad you yourself got to tell people that about the foundation that you're creating, and just your story and Georgia's story, because it's a very real reality for some people, and I'm really thankful that you were brave
No,
enough to come on and share it, because I know sometimes it's hard, and especially with everything that you've been through. I mean, so you're awesome. You
thank
guys are
you.
great, and I'm very thankful that I met you in person and really got to connect with you and to do more work on this, because there is a ton to do.
Absolutely. I'm here with you all the way, my dear. I mean,
Yes.
I feel the same way. I don't want to repeat the words that you did, but I feel like Dr. Kalish connects people because she knows and obviously there's power in numbers. So we're going to do some really exciting
Yep.
things with this foundation. We're going to grow. We're going to be big. We're going to make a difference for not only our children, but all these BWS babies that are coming forward. And we're going to make it not a scary thing. We're going to make it a knowledge thing, a power thing. And we're going to have standardization of care. We will. I'm 100% sure about it.
Yes, we will.
So, all right.
Yeah, you're so awesome. I'm so excited.
Thank you. I'm excited too.
Well, thank you again, and enjoy
the rest of your day as well.
And hopefully, and hopefully we'll get to Italy. We're going to get to Italy in May.
We're going from hell or high water. And lots of babysitters.
Yes, exactly.
Right? All right, you guys have a wonderful day.
Well, have a good day, and
all right, bye Teresa. Bye everyone.
Bye. Yay! So Gloria finally got to come out and share about her foundation, which is, I've been keeping that, locked down because it wasn't my news to share. We are just so excited to really just collaborate with so many different people, Chop, Monica from the Italian Foundation. We really want to, like Gloria said, knowledge is power. We really, really want to help these kids and make people realize that there is a standard of care. People just don't know about it yet. And that is huge because Georgia could have been in a much different place. She might not even be here today, which is a really scary thought because when you go to a hospital, you automatically just have your trust in where you're at. So our goal is to really make people aware that these resources are out there. So super excited about her foundation and just everything we're doing. And I'm really thankful for all you guys that deal with the technical difficulties. I swear one of these days I'm going to find a way to streamline it and make it not so difficult. But every time I solve it, something new happens. Let me just scroll through oh, Rebecca, Georgia has UPD type of BWS, which is also the same type of BWS that Owen has. They have the same one. So let's see. Hey, David. David's on here. He's from Romania. And thank you, everyone who's new on here for watching. Feel free to share this. Feel free to add people to the page. It's hard to reach people sometimes because it is such a rare thing. So like Gloria said, strength in numbers. So help us share. Hey, Kelly. And just help us get this out there. And next week we will have another segment. Stay tuned for when that is because I really should know that when I'm on here, but I forget. I have so much going on. Oh, Crystal, I didn't know that you guys have UPD type. I did not know that. Yeah, so we're gonna do it. And the Italian conference, for everyone that's wondering, well, they're so great. They don't even want to call it that. They're calling it the first ever international conference for BWS. That is in May, and we want to be there so bad. I want to be there with my family. I want to meet all these other families. So we're gonna really, hopefully soon, once I'm better, start to ramp up the fundraising for that. So yes, everyone feel free to share, and thank you for watching, and have a great day.